Welcome to PrognoCIS, the most cost-effective, comprehensive EMR system for your podiatry practice today. PrognoCIS makes it very easy to create encounters for your patients and turn those encounters into billable charges. Here I'm looking at my homepage. I'm Dr. Marcus Welby. I can see the next patient that I'm due to see is Mary Blankenship. She's coming in for heel pain. She's currently in room 14 with the medical assistant, and I'm going to click on Mary's name. Instantly I see Mary's face sheet. I can see all of her past medical history, current medications, allergies, all her past surgical histories, etc. I'm ready to start working on this patient, so I'm going to go to just take a quick look at the vital signs the medical assistant was just taking. I very quickly review that, see the information. Down at the bottom right, I have a workflow arrow that points me to HPI. In the HPI screen, I have a nice pick list of the different complaint reasons that patients come to our office, and I can also see over here the reason the patient is coming. The appointment was originally for heel pain, so I'm going to just start typing heel pain. Now, a patient may also tell me that they've had a problem with ingrown toenails, so I can choose as many different complaints as I need to from my list here, and the system will then give me a nice series of questions to address each of these problems. These templates are completely configurable, and I can check everything off very quickly, and if I want to, I can just come down to the specific areas that need changing, differ from the defaults. So I could specify the pain that the patient's feeling. Notice this template is relating to the heel pain. If I want to, I can ignore the template. I can just come down to the notes at the very bottom and just type anything I want. If I click on the other complaint this patient had, which was the ingrown toenail, then I can see I have a totally different set of questions. Here again, I might just want to check off everything nice and quickly and then just choose exactly which digits these painful ingrown toenails are located on, and perhaps I am all done. Notice I have a little green arrow down at the bottom. This is my workflow arrow, and I can just click on that. It takes me to my review of systems. Notice in this case my review of systems has automatically been copied over from the previous visit, and I can see exactly where the patient had problems last time under cardiovascular, integumentary, neurologic. And by clicking on any of these areas, I can see on the right hand side exactly what the problems were that the patient had. I can make any changes that I need to as well. If I'm done with this, then the next little green arrow at the bottom right takes me to my physical exam. Here I can choose the appropriate template or templates for this particular visit. So in this case, I'm going to choose heel pain first, and you'll see that I get good questions relating to the heel pain. Bear in mind that all these templates are completely configurable to suit your own personal style. So as I check off everything here, I have the defaults, but I can come down here and specify any changes as necessary from these defaults. Some of the questions are going to be drop downs, some of them are going to be yes and no, some of them are what we call multi-select. So I may want to choose more than one item rather than just having a single choice. Sometimes it's useful to be able to jump into your diagrams. Here I can choose the specific diagram that I want and indicate maybe I want my plantar. And with this diagram I can choose from my customized icons. So I could choose my pain icon, indicate exactly where the pain is. Perhaps the patient had a screw in this bone here from a surgery, and perhaps more pain here. Now, notice that this is creating a nice little table on the right hand side, and I can put in any notes that I want to and indicate why this screw is in the person's foot, for example. My next little green arrow at the bottom right is pointing on to the assessment and the plan. You'll notice here that the system has already chosen a couple of likely ICD codes based on this patient's visit reasons, but I can always jump into a list of diagnoses by clicking on this plus sign. I can go from my preferred list into the entire ICD-9 database if I need to. And I can search by description or by code. And perhaps I want to bring this one in. And I can add that to my preferred list at the same time. I can also do separate assessment plans for each of these complaints just by highlighting the appropriate complaint or diagnosis while I'm filling in the boxes to the right. I can do this with handwriting recognition, I can do it voice recognition, or I can jump into my preferred phrases if I want to by clicking on the binoculars. Here I can come into my preferred phrases and choose the appropriate item that I need to. And so perhaps I want these two assessment notes. And the same thing goes also for the plan notes. I can click on my binoculars there. These phrases are very easy to program right on the fly, and I can choose the appropriate plan for each of these complaints independently. Notice that I can also indicate the follow-up that's required. Patient needs to come back and see us in 3 weeks, and the reason why. This will automatically go as a pop-up message to the front desk, so by the time the patient gets up there, front desk will know exactly what needs to be done. At this stage, I could also go ahead and prescribe a medication by clicking on the RX button, order a lab, order radiology, or a consult. Perhaps I want to go on to my Enm Calculator to see what I can qualify for. So the little green arrow at the bottom right happens to point in that direction, but I can always choose from the list on the left-hand side as well. In my Enm Calculator, notice that the system has already suggested that I can do a 99213 and tells me what I'm missing to get to the next level. I need to add one more review of system, at least one more of past medical history, family history, social history, etc. So I can take the advice, the system has highlighted this, and I can go ahead and confirm that by putting a dot in this little radio button. At any time, I can click on Progress Note to view the progress note that has automatically been created as we've been going through this encounter. If I'm all done, I can go to my encounter close. This gives me a nice summary of what's been done on this patient today in terms of labs, radiology, prescriptions, letters sent out. I can see I've got my follow-up for 3 weeks to review x-rays. Perhaps I want to send this patient on to another specialist. I can do that as well. If I think I might want to come back and finish this note later, I can just simply tell the system that I want to send the billing data by just checking the checkbox that says Create Claim. However, if I'm completely finished with this patient and I'm ready to move on to the next one, I can just mark the encounter complete and then just hit my save. If I come back to my home page, I have a nice check-off where I can see what patients have been completed and which ones are still to go. So you notice now that Mary Blankenship has indicated as complete. Now I have a link in the upper right of the screen that says Switch to Billing, and I'm going to click on that. Notice in the biller's view they have a home page that is similar in some respects. They have their inbox messages, they have nice financial summary information of what's going on in the practice, and as soon as the provider indicates that something is ready to bill, they can instantly see that. So Mary Blankenship, the doctor, indicated this item is now ready to bill. So the biller is going to now approve the charge by just clicking on the claim button. At this point, the biller is able to see everything that the provider has done in terms of selecting the ICD codes and the CPT codes. If anything needs to be changed, they have full control over being able to add additional CPT codes or HCPCS codes that might have been left off, or the addition of modifiers or ICDs that need to be changed. From here, the biller can also view the progress note just simply by clicking on the progress note button at any time. But if this claim is ready to go, everything looks good, then it's just a matter of clicking on the Ready to Send checkbox. As soon as this claim is saved and marked Ready to Send, it is queued up for billing. When the biller is actually ready to send claims, they can just simply go to the Claims drop-down menu and choose Send Claims. The system will then present the claims that can be billed in a variety of categories. There's EDI, there's CMS, secondary CMS, and patient statements. Each one of these tabs house the appropriate claims that are ready to go. And at the very bottom, I can see the total number of claims and the total dollar volume amount that they apprise. By clicking the top check mark, I can check all of these at one time, hit the process button to send those claims right to the clearinghouse. I can quickly check for claims that have been returned. I can also see any reports, whether it be tabular reports, patient aging, insurance aging. All of the reports are very detailed and can be very specific to your practice to have the reports that you would like to see on a periodic basis. All reports have good selection criteria, so I can choose whether to do it by specific month or date range. I can choose whether to do it for one physician, for all physicians, and choose my criteria appropriately. Billing staff have instant information to useful information that allows them to quickly discern the patient's situation. At any time, if they need to be able to pull up and view a patient balance and explain exactly where that balance came from. The screens are quick and easy to retrieve that information. If a patient ledger or patient statement needs to be generated, the appropriate buttons for billing allow us to quickly get that information. So we see that there's just a very quick transition from the EMR side over to the billing. The billing can instantly turn it into a claim, and you have a variety of excellent tools to be able to not only make the clinical side of your practice work, but also ensure that the financial health of your practice stays very much ahead of the game.